Hi, I'm Jude. I'm an occupational therapist and I'm here to talk to you today about how to reduce the risk of leaning in a chair. So if you're caring for someone who tends to lean to one side and you're concerned about how this might be impacting on their health, in this video we're going to look at why lateral leaning happens, the clinical risks if it's left unaddressed, and how specialist seating can help support a more stable posture. Leaning is rarely caused by just one thing, and as OTs, we take a holistic approach and we consider the person, the chair, and the environment. So just looking at those in a bit more detail. The person, we would look at how is their health condition impacting on their postural control and their core strength? Do they have reduced range of movement or any fixed contractures? Is there pelvic obliquity or scoliosis affecting their skeletal alignment and causing asymmetry? Do they have pain or skin breakdown? Are there issues with high or low tone? And are there issues with proprioception, so their awareness of where their body parts are in space, or visual neglect, fatigue, cognition, or mental health? In the chair, we might look at things like the depth. So if the chair is too deep, the person using the chair might slide their bottom forwards and lean back. If the chair is too shallow, their feet might be dangling in the air, so they're lacking in support and stability from the floor. This can lead to them sliding forwards in the chair to try and seek out that support. And if the chair is too wide, then the person lacks lateral support. Looking at the environment, we might be looking at the location of any social interaction, what the person is wanting to engage with. So are they wanting to watch the TV? Is there some, do they have friends who they're wanting to speak with? Is there lighting that is creating glare and they're trying to move away from that? Similarly, is there a source of heat that is uncomfortable? So if they're sat next to a window and it's very sunny and very hot, are they leaning away from that window? The placement of everyday objects, whether they're accessible or not, so even things like a book or a glass of water. Work surface heights, are they too high, too low? If they're too low, the person might be then leaning forwards to try and reach that surface. Auditory triggers, so if there is a noise that is unpleasant that the person is trying to move away from, or the opposite, if the person is struggling to hear and they're trying to lean towards something that they want to hear. And then also the floor, so is the floor on an incline, is it level? So if the floor is on a slope, the chair is on a slope and the person is also on a slope. Leaning is not just a comfort issue, it's a clinical concern that needs to be addressed promptly, as it can cause an increased risk of pressure ulcers and postural complications. So adjustability of the chair and the accessories available can support a reduction in leaning. Options such as the tilt in space, which tilts the chair without altering the hip angle and uses gravity to bring the person back into the chair. A waterfall backrest can provide support along the full length of the spine. A cocoon backrest wraps the upper body to distribute weight. Lateral supports can be used where clinically indicated to gently guide a flexible posture back towards midline or to safely support a fixed posture. Wedge cushions and horseshoe cushions may also be appropriate. A joint assessment with your healthcare professional and an equipment specialist is essential to map clinical recommendations with appropriate seating. This chair next to me is the Lento Mobile, which is fully adjustable, has tilt in space and a waterfall backrest as standard. A Lento Mobile accessory kit is also available, containing different cushion types to enable the seating assessor to trial and configure supports to meet individual needs. In summary, leaning to one side is a common issue, and because every individual's needs are different, there is no one-size-fits-all solution. A professional seating assessment is essential to address individual needs. Vivid Care offer free, no-obligation assessments and work alongside community OTs to ensure chairs and accessories are configured correctly for each unique user.